2025 meeting minutes. If there are no corrections or additions, they will be approved as submitted. Seeing none, they will be approved. We'll move on to new business. Our first speaker is Brian Bailey, CEO of Mountain Laurel Medical Center, and he's going to talk about the AHEAD program.
Thank you. Yes. Oh, should take it. Cool. Thank you. So Jen, I'm going to blame Jen. Yeah, as we talked at the last meeting around the AHEAD model, Jen and I talked and thought it'd be a great idea for some of the major providers in the area to talk about their perspectives on the AHEAD model and what we are doing to prepare ourselves for that. So I have a couple slides up here just to kind of talk a little bit about remind everybody the AHEAD model is basically the Maryland total cost of care model that has been in place here for 25, 30 years, expanding nationally. So yeah, there's a lot of, hey, what are we doing to move ahead in Maryland? We've been doing this for 25 years. So it is really just an expansion of that. But there are a couple things just want to make sure you guys are aware of. Maryland has established a couple of work groups because we love to do that kind of stuff. So across Maryland, just to reiterate, the Maryland Regulatory AHEAD Working Group was appointed by the governor a couple of weeks ago, maybe, and a lot of alphabet soup going on up here. But the members of that group are the Department of Health, the Maryland Insurance Administration, the Health Services Cost Review Commission, that is the agency that regulates hospitals in the state of Maryland. The Maryland Health, MHDC, the Maryland Health, I forget what it's called, but it's part of the Maryland Healthcare Commission. Sorry, they kind of regulated a whole bunch of stuff. Dr. Baczynski used to be on that commission representing Garrett County and primary care, and the Maryland Health Benefit Exchange. So all of them are looking at this to address the issues of the OBBBA. The objective is to look at $460 million in Medicare savings and to manage the cost growth in Medicare and Medicaid Advantage plans. Yeah, as we watch all of this, in Maryland, Medicaid is managed through the managed care organizations. So Maryland Physicians Care, Aetna Better Health, there's a number of them out there. Medicare has Medicare Advantage plans, but it's about 15% of Medicare recipients are enrolled in managed care plans. Most people love the freedom of traditional Medicare because you can go anywhere you want to without authorizations, et cetera. So one of the things that I'm going to be looking at is Medicare Advantage plans have not been the most stable financially. So is there a way to stabilize the Medicare Advantage plans to entice people to move to Medicare Advantage plans as opposed to traditional Medicare? We've seen great success with managing Medicaid under the Medicaid managed care plans. Perhaps there's a better opportunity to manage Medicare. Medicare spend, if you look at a graph of spend through the lifespan of an individual, it kind of goes at a little spend, and once you hit Medicare age, it goes like that. So that's what they're trying to look at. On the one big beautiful bill, just to kind of, can I click that down just to get rid of that? We're not limiting people, we're just taking it off the screen. So lots of things going on with the OBBA that impact Medicaid. So the timeline of this goes out into 2029, but obviously it'll continue. Effective next year, all of the states have to put together their eligibility for Medicaid to make sure that people are re-enrolled every 6 months. Used to be annually, now it's going to be every 6 months. So you can see some of the impacts up there. Looking at the Affordable Care Act, I think that there was just legislation passed to continue with the ACA plans for the next 3 years, I believe. I didn't read the aspects of that, but the Affordable Care Acts were in jeopardy. Sounds like they're going to be out there for the next year. But really in 2027, all of this kicks in. So the Medicaid re-eligibility has to happen every 6 months. We have to make sure that patients who are eligible for Medicaid, I believe, either have to demonstrate hours of volunteer, being in school, or actively seeking work. So that might change the eligibility a little bit differently, but the purpose is to make sure that the number of recipients on the Medicaid program are the ones who should be on the Medicaid program. But that's going to create some strains across the organization to make sure that we track all of this stuff. You can see some of the other things that they're looking at there, but the protecting the Medicaid and the Affordable Care Act has been something that we've all been advocating for. So you can see some of the pressures going on at the regulatory side. Other things that are going across the state, the Maryland State Health Improvement Plan work groups. I believe, Shelley, you might be involved in some of these. So, there's work groups. Again, I think Shelley went through some of these: chronic disease prevention, access to care, women's health. You can see the other ones that are up there. So there are groups across the state that are working on that. And then lastly, we've talked about our input on the Rural Health Transformation Grant, the Maryland framework around healthy workforce, expanding our health systems and food is health. And then CMS's goals is kind of aligned with all of that stuff, but you can see some other things up there: tech innovation, innovative care, sustainable access. So all of that is I think good messaging for Garrett County and Western Maryland. But we have to be very careful about our involvement in this. Being involved in this is important. Don't just be somebody's watching from the sidelines. An active participant in all this stuff is what we're all obligated to do. And I believe most of us are across Garrett County. So just want to make sure that we're engaged. So a couple of things. What is Mount Laurel looking at as far as our next steps to align with all of this stuff? So certainly, as a safety net provider in the community, we want to make sure that we're protecting access to Medicaid. So one of the things that we're going to be embarking on is informing the community about Mount Laurel, what we do. It is often that we step across people who are like, I didn't know what a community health center was. I didn't know that you are there to serve patients regardless of their ability to pay. I thought, that you were kind of like a private practice. So we're going to be doing more education so that people understand that the options when you have no option is Mount Laurel. We never turn anybody away regardless of their ability to pay. So education to the community is going to be a big deal. Community assistance workers. So at the front desk, we have registration team members. They are now becoming certified as community assistance workers. What is that? Used to be called insurance navigators, but the terminology has changed. So what their role is to connect patients, navigate through their insurance options. So more people at the front desk who are going to be there to help people who are uninsured or need to understand their insurance options. So the front desk at every site, Mount Laurel community assistance workers are present now in order to help people navigate through their insurance needs. And then expanding our outreach effort to the community at targeted events. We all love community outreach. Sometimes it is just PR. Participation in parades doesn't get you a lot of patients, but it is something that we like to do. Trunk or treats, lovely things. None of us are signing up patients at trunk or treats. So one of the things, for instance, that we are doing is going to be an effort to reach out to the Medicare community through all of the senior centers in Preston, Allegheny, and Garrett County. So we're working with the various agencies to set up Mount Laurel on a road trip throughout all the senior centers, just as an example, to make sure that we get to the community where they are and see if anybody has difficulty in accessing healthcare and help them navigate through that. So it's going to be intentional out in the community. So protecting Medicaid access and Medicare access is important. Advocacy for patients' engagement in care. Yeah, we always say we set up our enabling services at Mount Laurel so that you have no excuse not to come. I don't have insurance, no excuse, you can come. I don't have transportation, we will pick you up. We do all those things in order to make sure that patients are engaged in their care. We've added some additional technology recently to make sure that the patient experience in terms of registration, in terms of insurance access is out there. So for our existing patients, making sure you do a lot of stuff you can do online through our patient portal and other ways to access Mount Laurel is all there. We are creating chronic disease management work groups. So we already have a diabetes self-management education program, but we're going to be expanding that to cardiovascular and other issues so that groups of patients can collaborate with our case management team and figure out how to best navigate through their chronic diseases. Prior to prioritizing cancer screenings, big deal. Making sure that people are doing their regular cancer screenings. We have a new population health tool that we're implementing that will always signal to us whether it's Brian's time for a colonoscopy. Who likes to get that message? Steve loves them. So we have to think through about making sure that patients age appropriate, gender appropriate, are prioritizing their screenings. Wellness visits, making sure that you're engaged in wellness is very important because that's an opportunity to check in and make sure that we are, whether you're an adult or child or children, establishing some baselines for children. For adults, making sure that we have critical conversations around disease prevention and make sure that we're doing the right thing there. Lastly, integrated substance abuse disorder. The stigma of substance use disorder is obviously we're all aware of that. So we are navigating through a way. Many of our patients like to go someplace else for their substance use disorder, and sometimes that's a far distance, and they do that for privacy purposes. So to try to reduce that stigma, we are going to be expanding our SUD services at Mount Laurel at all of our sites so patients can access their drugs at Mount Laurel. They don't need to travel a long distance. So reducing the stigma of behavioral health as well as substance use disorder is one of our priorities. So engaging patients a lot more in their care and making sure that stopping at Mount Laurel is important. Expanding access to care. This is a great thought, and obviously it has to come with some funding, but we have already started a number of things here. Behavioral health access to children and adolescents and school-age children. Previously, to access behavioral health for adults and children at Mount Laurel, you had to be a primary care patient at Mount Laurel. We changed that about a year ago, that you as a child or adolescent can access our behavioral health regardless of whether you're a primary care. And we've worked with Garrett County Schools. We have partnered with Wellspring and Lovelight to make sure that we are trusting each other, that a patient that is referred to us, we obviously send them back to their primary care doctor. So that trusting relationship has been terrific to expand access for behavioral health. School-based health services across 3 counties. We are currently working with the superintendents across all 3 counties to tailor school-based health services the way they want to see it. I think I probably mentioned specifically in Garrett County, determination was right now that school-based health service, traditional school-based health services at the schools are not the way we're going, but we have established a collaborative between Mount Laurel, Wellspring, Cornerstone, and Lovelight that we will work with Garrett County Schools to coordinate care better for all the students. So that process is underway. All players are engaged, and we are working with the schools in order to coordinate that messaging right now. So that's our hopeful rollout here. Allegheny and Preston are looking at more traditional bricks and mortar, perhaps mobile school-based health services. So we're working through that right now. In order to support that, we have some new pediatric providers starting in Oakland and Westernport. So we're pleased to have a new nurse practitioner in Oakland and a new physician assistant in Westernport. So that will help us enhance our access to pediatric care. And then the HERC Healthy Together grant, which David from AHEC West has been a terrific leader in helping us navigate through all that stuff. Shelley's involved in this. but just making sure that we are expanding access to cardiovascular diagnosis. We're going to be doing more remote patient monitoring, sending out technology with our patients that will feed back into the electronic health record automatically. We do it now through just kind of calling the patient and giving them some blood pressure monitors, but we're looking at doing more remote patient monitoring, starting with blood pressure monitoring, but there are other options out there that we're doing. So we are expanding access to care further, a little bit more recruitment of the workforce. You saw that was an important thing. So making sure that we are recruiting new providers is important. We have established new relationships with the University of Maryland School of Medicine and the Emeritus School of Medicine to do student rotations and eventually, hopefully, residency rotations to Mount Laurel. So that will introduce medical students to the options of rural healthcare. So we're excited about that. The School of Medicine University of Maryland has already started. Emeritus will start in about a year because their School of Medicine just opened this year. So they need about a year or two before the students start rotation to clinical. So inviting people out to the rural community is important. Other things that we're looking at, including resources, postpartum behavioral health services. Our psychiatrist, Dr. Melissa Scott, is certified in postpartum BH services. So she's going to be opening up her panel more for women suffering from postpartum. Peer recovery specialists as part of our expanding addictions program, bringing them onto the, as part of our practice site. We added community health workers kind of on the medical side, the peer recovery specialists. We're going to be probably looking into that next year to add it to the behavioral health and SUD side of the equation. And then lastly, an inspirational thing, Jen and I have want to expand dental services. So we've been, kind of dancing through a couple different partners, some discussions, nothing committed yet, but we know that the need for dental health services in the community is great. And so looking for ways that we can expand it. We are on the lookout for that, but that's a little bit longer goal. Can't do everything at once, but want to make sure that we are at least moving ahead with this stuff. Questions? We're busy. Yeah.
So your tour at the senior center, you may think about coming over the cart like on a Tuesday or Thursday.
Yeah.
Since Community Action leases space with us and they run that senior exercise group.
Yeah.
I think we're in the neighborhood of 400 to 500 unique Garrett County seniors that have been members at any given time.
Oh.
So that could be another possible location where you could get a pretty large group of individuals.
Yeah, definitely. Our objective when we go through the senior centers will obviously be educate the services, the Mount Laurel, but combine that with some sort of, today we're going to talk about heart disease, today we're going to talk about diabetes, and include some clinical health education along with that. We're not there just to sell services, we're there to educate also, so that's going to be the objective there. But thank you. Now we'll reach out to the cart.
Beth, is there anyone online with any questions?
No.
Cool. Last thing I just want to tell everybody, this is my last health planning council. I have resigned at Mount Laurel. We have a new CEO who hopefully will be appointed today. So it's time for retirement. And yes, I am of that age. Unbelievable, isn't it? But I just want to let everybody know that we do have a succession plan. New CEO hopefully will be starting on January 6th. So it has been my pleasure to be part of all this stuff. And you guys do an awesome job. Please continue this. And obviously, Mount Laurel will continue. I'm going to be there probably through March or so to help with the transition. But it's time to retire. So. But you guys do great work. Thank you.
Should have led with that.
Well, I want to start with the good news first, and then go on to the other stuff. But you guys have been great support, and wish you all well. I will be around. I'm not going anywhere. Thank you.
You have to turn. Good luck.
Thank you.
Thank you, Brian, for the information.
Sure.
And our next speaker is Shelley Argabright. Who's going to talk about the Population Health Action Plan.
It's wonderful that we have the FQHC in Garrett County and now the entire region, honestly, like all of the services, it's a pretty, it's definitely a huge benefit for our community, and we thank you for your service and your working with you. It's been a pleasure. So click out of here. The Population Health Action Plan is, I'm just gonna get this ready and teed up here. But that's next. But the Population Health Action Plan is part of what Brian just talked about, and that's the larger Population Health Accountability Plan, which is part of the AHEAD model. So many acronyms and all of this soup. It really does mean that we just are focusing on trying to align all of these different goals through all of these different things that he already mentioned this morning. So I'm not going to go into it. We are going to meet with our hospital right after the holidays and come up with a little bit more of a plan for the county as far as what's going to be in that action plan. It will correspond with a lot of the work we're already doing and just making sure that the linkages fit. And so we'll do a lot of that work here at the Health Planning Council. We will probably have some community meetings and other groups as well, just to make sure that the engagement is high and everyone has a voice, because that is the important parts of that work. So more to come on that. And then I'm going to go ahead, Donna, if it's all right, and just move to the next item on the agenda, which is the 360 Access Hub. We are going to just do a brief update. We started the 360 Access Hub last year, I think. And for those of you that don't know, we are located at 360 West Liberty. It's a food resource hub, and it's an enhanced dignity first approach. So my team and I wrote that a food resource hub would be in existence in Garrett County in 2027 through a Care First grant. So it's a little unusual that we are this far ahead of schedule. So that's a really cool thing. And it speaks to the synergy and the need and just sort of the stars aligning with our partnerships. And so we're able to be at 360 West Liberty because of community action, had a space, an available building, and we're willing to come alongside us. And then also Maryland Physicians Care was another just force really to be kind of move us in this direction of having a resource hub that's related to food. They've had a lot of projects around the state, showed us a lot of different models. And so those are the kind of the core three partners. And then we had, can't do this without funding, right? So we have local management board who gave us about 10 grand for some seed money. Healthy Together, as Brian mentioned, is a regional grant for Allegheny, and well, it's actually through the whole state, but in Garrett County, we share that money with Allegheny. Several partners are part of that, but food insecurity and chronic disease management are a piece of that. And then, of course, Care First is our other large funding source. So what's unique about this Dignity First approach is that it's all based on recipes and it's based on a client choice model. So there are many, we've talked numerous times, many places where you can go get food, where there are churches and community organizations that offer it. This one, as Brian said, you can't do everything at once. So right now you shop based on, basically you just shop on paper. You don't get to walk through a pantry because of the space. But ideally we would like for it to be almost like a mini grocery store where people come and they're able to shop the shelves and pick out the food that they want. But for now, we do it on paper, one-on-one as people come in, and we have these recipes that we are trying to incorporate so that they have them to cook with if they want. Of course, it's their own food, so they can do what they want. But people have really enjoyed the recipes. So you find everything at 360accesshub.com, and there is a help form. That's how everyone accesses it. So these are just, it's basically just screenshots of the actual form, and it's a pretty quick process. And so far, I'm going to keep going. The referral sources, these are the community organizations that have utilized the help form and sent us people that need help. So it's very, very easy. Anyone that talks to a community member can do it. A community member can do it on their own. And so obviously a food system change like this takes multiple agencies and buy-in. And so there isn't any type of income guideline right now. If you present as food insecure, you will be served. And so that's a pretty big benefit. And we would like to be able to have some consistency. So we see someone and then we invite them back, and we hope they come back for at least 6 months so that we can build relationships with them. We can understand a little bit more about what's happening in their lives and use it as a referral opportunity as well. So that's who's jumped on board so far. So again, 360accesshub.com/help. It takes you to the form. The form comes directly to me, John, and Kristen, who's in the room. She's the program coordinator. And then automatically we call, we email, and we get people scheduled in for an appointment. So of course there's a group on mygarrettcounty.com, and it's 360 Access Hub. And this is a light slide today. But so far we've received 105 guest registrations. So we've received 105 forms come in through that database to us. And we started live with those on October 31st. If you remember, at that time, SNAP benefits were postponed. There was a pretty big level of fear in the community with what was going to happen with people being able to afford food. So we decided to open and just put the form out live and see what happened. And so we had an initial kind of big burst there in the beginning. We had 78 forms come in. And so we were able to get in touch with almost everybody and get them serviced in November. And then yesterday we had our second day at the hub. And so in total, we've been able to service 126 of those people. So that's first time and second time. So first appointments and second appointments, and then walk-ins. So the numbers get a little hard to talk about because you have people that you might not be able to get in touch with, or that forget their appointment, or miss it, and they have to come back. And we want to make sure that we are serving everyone on this continuum. So volunteerism and fundraising are also being tracked in our action group, as well as the other partners and kind of their role in the hub. So check back often on that group. And it is also a way that we do volunteerism. So there's a training module. It's brief. You go to 360 Access Hub for the training module, but then part of that is that you need to join My Garrett County, obviously. So we have had some success there, and that's just a reminder of how to do that. And then obviously this doesn't happen without volunteers or agencies working together. So here's just a quick slideshow of sort of the initial, some of the initial photos. And we've done a lot of projects at the 360 Hub. My team, before it was open, before it was ready, we worked with our farmers. So that's always an amazing program. And we do a lot of fresh produce. So, and we work with the school system through that program. So the 17th, yesterday, we were there we were seeing people from 9 to 6. It was wreath making and grocery shopping, and it was incredible. The whole place smelled like a Christmas tree farm, because we had Christmas trees that were given to us at a very discounted rate that were deer damaged. So they were Canaan firs. We were able to had a volunteer who went to the farm, cut all of the limbs and 2 truckloads back to the hub. And in the very back room, for those of you who've been there, the whole room was branches for this wreath making. So it was really interesting and fun. And this was our first wreath making. And so the first couple people that came and volunteered. So the idea of the hub is not just for people to come and sit there and just wait on a food box, right? We want to create an environment where people get to know one another and they are chatting and feel a belonging and there's something to do. And there's, you can build relationship. It's a trusted place to go. And so part of that is having activity for people. And it takes a long time to make a wreath. I don't know if anyone does. It's not terribly long. So we had stages of this. So we had several tables and we had wreaths that were finished, wreaths that were half decorated, so that people could kind of have a choice. And so I'm just going to run through. I had to do a collage because we had so many people. And as I'm doing this, I'm going to read something that a volunteer sent to me last night about their experience. So this is the quote here. I'm not sure if this singular day was life-changing for anyone, but I know it was more than just a task for me as a volunteer. Most of the day I was near the main entrance and nearly everyone commented how great it smelled or wow, it's so Christmassy in here. I saw a smile on everyone's face, every single person. I witnessed at least a half a dozen people shed tears. Some seemed like tears of joy, others seemed sorrowful, and others were tears of gratefulness. Everyone was full of thankfulness, including the volunteers. I don't know if this moment changed anyone else's life, but it changed mine. And I do know that more programs like this are definitely needed, and I consider myself very fortunate to be a part of it. And it was a pleasure to be there. So it's just a testament that it's basically, to me, demonstrating that when you just get people together, it really reduces stigma. Everyone's there working on the wreaths. And, we have greeters, people are kind of filing through. There was a hot chocolate station. And people were comfortable to come back out. And not one person said, don't take my picture with my wreath. Everybody wanted their photo. We had Appalachian Crossroads come out. They brought their volunteers and we of course let them take their wreaths back. And they were so excited to be there. And these are just guests that came through. So we had some guests in the room. Some leadership obviously came. And this gentleman looked at me like I had 4 heads when I told him we were going to be wreath making. And look at that smile. He absolutely loved it. And so we just had a great day. My girls were in. And so everyone's home from college. And we had 19 volunteers for the day. It was a very volunteer heavy day. 5 of them were college students. And so, you know what? It's just like tons of fun. There's Kristen. That's at the end of the day. That's how much time we still have over there if anyone needs any greenery. But it just really was incredible. So this is just a little behind the scenes. So that's what it looks like in the back with the Packers. And then this is through the window at some of the one-on-ones. And the pine was kind of piled in front of the windows. And so that's the middle picture there. And then it's just a sampling of what people could order. But at the first appointment, we do a food insecurity screening. It's just the 2 questions that we've talked about in here before. It's the USDA model. And then at the second appointment, we've had the ability and opportunity to work with American University and their evaluation team through the Care First funding. And so we're really looking at, all right, well, what do we really want to capture? We want people to come to the hub, but we don't want them to keep coming to the hub, right? We want them to get up on their feet. We want to make sure our agencies are working together so that they don't need to come back to the hub forever. And so how do you start to evaluate and measure those kinds of things? And what kind of questions do you need to ask while you're building relationships? Because you can't ask people so many questions and they're like, do I need to get blood to be served, right? So you just really need to be careful about that. And we've worked with that team who's helped us refine some of those measures, and it's been a really cool opportunity. So our one-on-ones, we had Kristen that does that pretty much the whole time. And then we had Nancy from Personal Health come in and help us. She is a certified community health worker. And then we also had my daughter's in the back corner, Lillian, and we had several different volunteers who have been with the program throughout and felt comfortable kind of working through those questions with folks. So we also need it to be approachable because we want it to be community driven and community led. So this first set of questions are really about, what kind of foods do you like to cook? Like, what's your kitchen situation? Do you go to other food pantries and other services? What is that like? And so things like that. Has anything changed? And so when you sit down with folks, I get all kinds of personal health information, and I'm like, right? But people really, really want to share. There's some exciting things happening in people's lives. I had one woman talk about her A1C. I can't take credit for that at the 360 Hub. She talked about the recipes. She talked about making healthier choices, and her A1C is coming down. She wants to report to me in January. I'm like, great. But that's a lot of excitement. Her A1C was above 10 when she started. So she said she was at 6.7 yesterday. And so there are just opportunities to talk about all kinds of things. We did have WIC come out, and this is at the end of the day. It was like 8 p.m. So it's worth it. Because we had 58 people yesterday, and they'll be back in January. They're excited. We had some walk-ins, and it's not perfect. It's one step at a time. And we're not open 5 days a week. You have to wait. You have to fill out the form. There's still a few barriers, but people our agency partners and other people are using the form. We're looking at that referral open field, that text box in that form. So all of you who are listening, please use that. And you can go through the form with people over the phone. It's really, really simple. And then once they come, and once we can get in touch with them, they seem to really, really enjoy the experience. And so if you're not a volunteer, you want to be a volunteer, there's a lot of different ways to do that. And it's just been a pretty cool thing so far. So we're happy that we have it in the community, and are thankful for each of you as we kind of usher through this slow systems change to really look at how we can better serve our community. Any questions about the hub? Okay, over to you. Let me get all the way out of here.
Shelley, have they done an article on you guys in the Republican or something like that?
When we had our ribbon cutting, we had an article. It was bare bones though, sort of a highlight. And so we don't have an in-depth one out yet. We'll probably write something.
Yeah, I mean, they're always receptive to,
Yes.
promotions like that. So
And the other part of that was we weren't sure what the demand would be.
Yeah.
And so we didn't want to push it out too much because
Right.
we didn't want to be overwhelmed at first. Community Action, we have a contract with them, so they are purchasing all of the food. And so we're all trying to sort of step together and make sure that we're not running.
Right.
And so when the demand gets a little higher, of course, I'll be reaching out for more help. The idea is that we can have more agencies there when we have these days. DSS has also helped us Several times we've been open, just so that people can talk about the other resources they need at the same time.
Sure.
But the space is small.
Yeah.
And when you have, I don't know, 8 tables of pine, we had to sort of scale back on that piece yesterday.
Sure.
But certainly open to ideas, all kinds of different partnerships, and expanding that and growing it with the community.
Great, thanks.
Any other questions, comments? We're to the agency update section, so I'll start in the room here. Any agency updates?
It's not really an agency update, it's more of a program update, I guess. Of course, we're all waiting for the rural health transformation funding announcement to come out, which should be at the end of the month. We'll see. What Maryland's anticipating to not qualify for a large portion of that competitive part of the rural health transformation grant, just because we're less rural than other states. But they are focusing as far as the health departments. We're going to be looking at mobile health service expansion and nutrition education and improving our billing practices. So especially with the mobile health, they're looking at doing a regional approach, having a hub for mobile health, and then the spokes out to the county. Don't really know what that looks like yet, but I want to put that out there for everyone to be thinking about how we could do mobile health in Garrett County.
Other comments? in the room? Anyone online have an update? You don't see any hands up there. Okay. Seeing no other updates, we will have an adjournment early today. Thank you all for coming. The next meeting is January 22nd, 2026, 8 a.m. here. Thank you all and have a wonderful holiday.
Still some, doing part.